Well, we are starting a brand new year, and for many, that means a new focus on health. And while it's good to know where your body is at, set a baseline, more tests and tracking may not always be better. We welcome author and professor Tim Caulfield for a closer look at this morning. Many ways for you to set this baseline, a lot of data out there, Tim. Let's start with some of them out there. Is there a benefit to, say, DNA testing?
Well, DNA testing, it's been around for a really long time. This is actually a topic our team has done a lot of research on. Since the late 90s, we followed this trend. And, the promise was more data is going to be better, right? Data, quantification, metrics. And it really did not play out. I've actually tried 23andMe. I've talked to, the executives at the company. It's kind of gone out of business. And that's because the data wasn't really that helpful for most of us, right? The data really didn't provide any kind of earth-shattering information. The advice is always the same. All the advice I got, Kent, was always the same, right? You exercise, you eat well, you sleep, you don't drink too much, it's always the same. And so I think that it sounds like it should be super beneficial. It really has not panned out.
Okay, now this one sounds a little bit more medical, at least sounds more medical. Microbiome testing or full body MRIs. Do people need to do these? Why do people do
testing,
this?
Yeah. Microbiome testing, that's poop testing. That's what that is. And again, that's something I've done. Look, really exciting research going around the microbiome. Again, I've been fortunate to be involved with some great scientists on this topic, but it really isn't there yet from a clinical perspective for most sort of health wellness conditions, right? And this microbiome testing promises that you're going to be able to tweak and personalize your diet. Again, the evidence isn't really there, but it sounds exciting because, hey, microbiome, we know that's cutting edge science. Again, data not useful yet.
Okay, now for a lot of people, it's the watch that they're wearing, whether it's Apple or whatever else, tracks their steps and their sleep and all that sort of stuff. Is there a concern about these smartwatches and how much data you can get from it?
So there's this assumption that more data is always better. In fact, that's the way this growing industry, and by the way, Kent, we should emphasize, this is a growing industry. We're not talking about the tests that your healthcare provider recommends. We're talking about these tests that promise wellness and optimization and et cetera, right? And this idea that more data is always better is false, right? Let me give you an extreme example. You talked about full body MRIs. This is the idea of getting your whole body scanned. That intuitively sounds like it makes sense. They're going to find stuff, right? But the reality is no evidence to support it. In fact, professional organizations recommend against it, right? And it could lead to anxiety. It could lead to iatrogenic injuries. Those are harms caused by the healthcare system, overdiagnosis, costs for you and the health, et cetera, right? And the same is kind of true with fitness trackers. There's been some research that shows it increases anxiety. It can make people obsessive. And interesting study found it can make exercise less enjoyable, right? Which, you want to enjoy your activity for sure, because it becomes all about the numbers and not sort of being in the moment, enjoying intrinsically the activity.
So is there any sort of tracking that is useful?
Okay, despite what I just said, Kent, I'm going to contradict myself. There is evidence that for some people, these fitness trackers can be motivating. So there was a big meta-analysis in Lancet in 2022. It found exactly that. There have been other studies that have suggested that, it does increase activity slightly. But I think it's really important to sort of reflect and ask yourself, is this working for me? Do I still enjoy working out? Because the goal is always, Kent, the basics, right? A healthy lifestyle that's sustainable. That's what's really going to make a difference.
All right. You always make a difference with us, Tim. We appreciate your insight as always.
Thanks so much, Ken.